Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Martin, your host for today's show. Franklin County Home Health Agency provides home care and hospice services to people throughout Franklin County. Through this show, we bring you information about the agency's programs and services, as well as helpful information to help you stay safe and healthy at home. We understand that it can be nerve-wracking when you or a loved one is admitted to a hospital or other medical facility and you have a lot on your mind. Thinking about the discharge home may be the last thing on your mind, but being prepared about the return to home process can mean the difference between full recovery or readmission to the hospital. So on today's show, we'll be talking about what Franklin County Home Health can do for you when you return home and what you can expect. So with me today, I have two guests from Franklin County Home Health, Jodie Archambault, who is one of our liaison nurses, and Amanda Wilson, who is a medical social worker with Franklin County Home Health. Thank you both for being here today.
Thanks, Jen.
And I'd like to just start with telling us a little bit about yourselves, your history at the agency, and some of the roles you've done. Jodie, I know you've been there as long as I have, so you can tell us sort of the different things you've done at Home Health.
I've been at Franklin County Home Health for 18 years, and I started as a high-tech continuous care hospice nurse, and I've worked as a home care nurse, a long-term care coordinator, and now I'm working as a liaison nurse, working on discharge planning and telehealth.
Okay, so I'm sure there's a lot of our viewers who probably recognize you from one of those many roles. So thank you. It's great to have you with the agency and to have you here today. So we'll learn more about your current job as a liaison nurse as we talk a little more today.
Thank you.
And Amanda, you're more a newbie, as we say.
A newbie.
Yeah, tell us about your history in medical social work.
So I've been with Home Health now for just over 2 months. Prior to that, I was 4.5 years at a skilled nursing facility here in town, and then I did about 4 years of community mental health before that. So in the nursing home setting, I did a lot of discharge planning as the social services director. So I've done discharge planning, sending people home, and now I'm doing discharge. Yeah, receiving people when they come to their homes, providing services.
So it's a great resource to have you understand all sides of the process in getting somebody home, and we're lucky to have you at the agency too. Welcome.
Thanks.
So let's talk about that a little bit first, a little background. In today's world, people often talk about leaving the hospital sooner than they remember in the past. Can you talk about that? Why is it that hospital stays seem to be shorter for folks?
It's been shorter for folks because the hospital has regulations that they have to follow, and they're sending people home a lot sooner than they used to, based on their regulations.
Sure. Yep. And luckily we have resources available to help that process go smoothly, like Franklin County Home Health or other facilities like you've worked in yourself. So maybe we should talk a little bit about that before we talk about some of the factors about returning home. Where are some of the places people are going at discharge when their services in the hospital are complete? Where do people go? And for what reasons?
They either go to rehab after a hospital stay, or they'll get a referral for home health, or some people just go home without any service depending on their level of function and their needs.
Sure. Okay. So what is your role as a liaison nurse then in that process?
So right now I go over to Northwestern Medical Center daily, and I work with the medical social worker and the nurse case managers over there, discharge planning for people that are going home. So if they have requested our agency for services, I'll go and talk to them in the hospital about what they can expect when they get back home. I'm also following our clients that are already active clients at Franklin County Home Health. So if I see that they're in the hospital, I'll go over and do a friendly visit with them, let them know that we know that they're there and that will be available to them when they come back home.
That's great. Nice seamless care and very personal touch. That's wonderful. So what are those things? What are the important factors to consider when someone's returning home? What do you talk with them about?
When somebody's coming home, we have to make sure that depending on what's happening with them, if they're going to be safe when they come home. So do they have family members that are going to be available to help them with their needs, or if they're alone, are they going to be able to meet their needs? So we're looking at are they going to be able to meet their nutritional needs, their medical needs, make sure that they're going to get their medications on time, make sure that a lot of times when clients are discharged from the hospital, they have new medications compared to what they have at home. So we need to make sure that those are matching when they get home, and if not, that they're getting the meds that they need. Making sure that they have a follow-up appointment with their doctor.
So you're helping them coordinate. There's so many things to consider.
Yeah.
I mean, that sounds
Yeah.
overwhelming if you're already in the hospital and
Yes.
you're recovering from something and there's a lot of stress. So it's nice that you can guide them onto all those things. So medications, for instance, like you said, would be a
Right.
big safety issue if that
Yes.
wasn't going
Yeah.
well. What about yourself? Are you getting involved at the hospital stage or when they get home?
Not at the hospital stage. The medical social workers get involved once the referral comes in, when the patient or client has actually returned home.
Okay.
Then we would get referrals and then get involved and help in whatever way is needed.
Sure. So a lot of things you were mentioning were things that might be on a patient's plan of care when they get home.
Yes.
Is that happening in the hospital, or when does the plan of care get developed?
It can start in the hospital, but a lot of times it gets developed when they're back home.
Okay.
But before they come home, we want to make sure that the client is going to be able to work towards meeting those goals, or someone's going to be available to help them at least when they first get home, until our staff can get in and help with those services.
Sure. So let's think about the, you mentioned, it depends on the person, depends on what their condition is, why they were in the hospital, what their situation is going to be like going home. So give us some examples of different conditions and what level of care they might need when they get home.
So if somebody's coming, if they're a post-op after a surgery, they may have wound care that they're going to need to do on a daily basis or twice a day. So they would need training on how to do that wound care when they get home. Some people are able to do it independently after training. Some people may not be able to, so then our staff would assist them through that, or train family members to help with that. Some people come home with IV therapy, and we're training families on how to administer that intermittently with us coming in.
So there's a lot of care that you're doing immediately, but that you're hoping if they can do it on their own, or somebody can, we're assisting
Yes.
them to take care of themselves at home at that, after we've assumed that it's safe and they're doing it right. And
Yes,
yeah,
yes. We're doing a lot of training.
And we'll get to another tool that helps with that later that you have sitting here on the table. But are some people more at risk then when they're leaving the hospital? What are some of the very acute instances?
Yeah. So the people that would be more at risk are the people that are frail and elderly. They don't have anybody at home to help them. They're not getting around very well, level of function wise. May have memory issues.
For sure. And what conditions, when they are home, are there certain conditions that are more prone to be readmitted to the hospital?
Yes.
And talk about how we try to avoid that and
Yeah.
what's in place with it.
People with congestive heart failure or COPD, new diabetics are more at risk of going in. We have telemonitoring that can monitor these clients on a daily basis.
Do we want to talk about that now and show
Sure.
off what telemonitoring is, or telehealth as we say?
Sure.
Okay.
So part of my job at Home Health is monitoring clients on a daily basis. We have telehealth that actually hooks right into clients' phone lines, and then the information comes to our office daily through the computer, and there's a nurse that monitors that daily. So a lot of the clients that we are using this on are people with congestive heart failure, because we're monitoring their weight daily, because if someone with that disease goes up 2 pounds or 3 pounds in a day, that can be, they may need a medication change. People with COPD who have breathing issues, this monitors their oxygen level. People that have high blood pressure, we can monitor that daily and let the physician know about any variations in the blood pressure. So I guess we can do we're going to do a demonstration of how this works. This also
See how you're feeling today, Amanda.
This will also ask questions based on disease. It will remind the clients to take their medications daily. It will ask questions around, like, say, if somebody has congestive heart failure, if they're feeling more short of breath today, or do they have more fluid in their ankles. So based on someone's diagnosis, I will add questions.
So you program it for each person's needs,
Yes.
and it's going to check what's important to them that
Yes.
day. That's great.
Yeah, and I usually will have a question on whether they need somebody to contact them today. So if they have a nurse, the nurse may see them maybe once a week or twice a month. So this triggers them that if they need to ask us a question, that they can say yes, and someone will give them a call.
When they say yes, are you alerted then? That
Yes,
they need
I
this?
get alerted, and I will call them to see what they need for the day. So we're gonna do a retest.
If you would like a retest of a complete set of vital signs, please press yes. Good afternoon. It is now time to record your vital signs.
So they would put this on themselves, or somebody in the home could put this on themselves.
Yes.
It's easy to do.
Yep. And it prompts them through.
Please sit down on a chair in front of the monitor.
And it gives them plenty of time too.
That's a good
Place
point.
the blood pressure cuff on your right arm,
Oh, you want
above
my
the
phone?
elbow.
Oh yes.
Tighten it securely.
So actually you're just gonna,
Do I have to do this?
we actually set this up for the client's arm, so then all they have to do is pull it up.
Yes.
That was set for me.
Thanks.
And it does give plenty
Place
of
the
time.
finger sensor on the middle finger of your left hand, with the finger design facing up.
Yeah, good job.
Thank you.
It doesn't hurt, huh, Amanda?
No, it doesn't hurt a bit.
Hasn't started yet.
Oh, it's nice. It's clear. It's
Rest your
loud.
arm as instructed by your clinician. Press the green Start key.
I'll do that for you. But usually they can, we set it up so they can do it. It's looking good so far.
About how many times does it take for you to train someone on this? Is it?
Usually the first time that we have staff that go in and train the client on how to use it. And if they have trouble after, I can either talk to them by phone, or we'll have someone else go back out and work with them.
How many years have we had this? About how long?
Please
A
remove
few
the
years,
finger
at least
sensor
5.
and the blood pressure cuff.
And then it should ask questions.
Please answer the following questions using the yes and no keys. Are you experiencing more difficulty breathing today compared to a normal day? Do you need your clinician to contact you today? Have your ankles been more swollen than usual? Are you having any dizziness? Please remember to take your medications as prescribed by your physician and maintain the proper diet. Thank you for completing your vital signs measurement.
That's neat. So all that information is immediately transferred through the phone line
Yep.
to home health, and yourself is at a computer checking out
Yes.
how they're doing that day.
Right.
So this is not replacing nursing.
No,
'Cause
they still are getting nursing visits and physical therapy visits or LNA visits. It's just giving them extra care. Somebody's monitoring them every day.
Yeah, which is something that's changed the way we have to make visits, it's been helpful. How does it affect the whole
Right.
system? Because
Yeah.
they're getting actually more care than having to send somebody out on the road to check vital signs
Right.
like this. Sure.
For example, this last week we had a client whose blood pressure was low and the doctor wanted it monitored daily for a week. So instead of sending a nurse out every day, we set up the home med and we were able to monitor it every day
That's great.
and then send the doctor the results.
That's great. So about how long might somebody have this in their home, I guess, depending on their situation?
Depending on their situation, but usually we'll do like 1 to 2 months. Or sometimes we just put it in for a couple of weeks to monitor their blood pressure. We have had people on the equipment longer, someone that has congestive heart failure that is really at risk of going into the hospital. We've actually had it in there for more than 2 months.
Now, is this always implemented just after someone comes home, or is it preventative too, so that they're in a condition where they don't go to the hospital?
It's both. It's we look at the referrals that we get, and if we have somebody that has the diagnosis of CHF or COPD, or if they've are new cardiac or high blood pressure, we're talking to them within the first couple of days to see if we can set the equipment up. It is voluntary based for clients, but we do highly suggest it. We have people that have been on it. We've been able to prevent them going back into the hospital because we're monitoring them, and we can call the doctor and show the doctor what's happening and do medication changes or teaching on the phone about diet. And
That's excellent. It's a great tool. You also had a scale, right?
yes,
With this, it will
yes,
weigh them.
it also comes with a scale. I did not hook that up today, and the scale is, quite wide, so it's safer for clients. It's more stable because a lot of the scales that are in the home are
I
smaller
never
and
considered that.
can be
Yeah.
difficult for them to get on.
Talk a little bit, thank you for sharing that. It's a really cool thing. I think it's helpful for people to see it in action and know that it's not complicated, it's simple, and anybody can use it, and it's really helping to keep people out of the hospital or to help them recover from coming when they
Right.
come home. So that's really cool. So talk about some of the care people get from the hospital. We have a medical social worker here and nursing, but what other services are implemented when someone comes home from the hospital? Either one of you, what kind of things at home health might somebody need right off to help them stay safe at home after a hospital stay?
A lot of times you'll see physical therapy on the referrals. Somebody, usually after they come out of the hospital, they may be weaker. So there'll be physical therapy for safety evals, for strengthening exercises. They may be doing equipment evaluations. Same with occupational therapy. They will be going into, so example, if somebody's had a stroke, they could be working with that person on different ways to be able to manage their personal care or their housekeeping type things that they were able to do independently before, and they may have to do it in a different way now.
Sure.
The MSW referral, I think, is sometimes underutilized. We sometimes get referrals coming straight from the hospital. A lot of times they're referrals that come after therapy or nursing has been in the home and identified a need. If they say this client could benefit from this piece of equipment, but they don't have the funds, then social work can help get involved and help access resources
Yes, okay.
for clients.
So a lot of that you might be able to even do ahead of time, so that at time of discharge or coming home from the hospital, if you're informed of these things, you can help them find those equipment that they're going to need before they have services.
Yep,
that
it's
you're
good to
involved.
have a heads up about someone that may be transitioning home, so we can do some of that back work and that planning and research.
Yeah. So in addition to helping them locate funds for equipment, what else is the medical social worker doing at discharge?
There's a lot that we can do. What we like to do is go in and do an initial assessment, just like all the other disciplines, and identify what the client needs are. We can help obtain equipment, access resources, financial, assess family systems and resources of family members. There's a lot of community resources that we can help access for clients, CVAA, Meals on Wheels, Lifeline. We do a lot of long-term planning, so really planning for the future, advanced directives, and then communicating that with families. Supportive counseling for clients and families through disease processes, as well as anxiety and depression. So there's a
offer
lot
a lot
that
of
we do.
resources to a family and to a patient, and I'm glad you mentioned all those, because I think, like you said, it's sometimes not well understood, and there's so many things to consider. Like you said, advanced directives alone is a huge piece, and then family dynamics or helping people with resources. So it's a real resource to have you at the agency and these people, especially at that time of what could help, and you wouldn't know it unless someone maybe shows you some of those.
And I don't think people often realize what it's like at home. You go from being in a hospital where there's people there all the time, or a rehab center where the hallways are wide and everything's set up perfectly for you to be successful, and then you get home and it's very different. It's home and it's comfort, but it's not always as conducive to safety and success as it needs to be. So that's where I think home health disciplines can really help.
That's a good point. But you did mention a lot of the resources locally, so the agencies that we collaborate with in different ways. So I think that's a good way to show that our healthcare system in the hospital, the doctors, home health are all working together.
Absolutely.
To help these people get what they need at this time of transition, and then, like you said, future planning, so that they stay in contact. Let's talk a little bit about, I forget where I was going with that. You guys, any other things you want to share about that we haven't mentioned about being released from the hospital and coming home, and how home health can help you through that transition?
I don't think so. I think the discharge planning process is really important, and that's where it begins, whether it's in the hospital or at the rehab center, and starting those conversations early throughout your stay. Leads
I guess
to
for a patient,
success.
who do they talk to? Like, so how does home health start? What's the referral process actually when, for the patients? If they had considered home care right now, they're hearing about this and they want to talk to somebody, who do they talk to first? Do they call us? Do they talk to somebody at the hospital?
They can actually call us and talk to us about what their needs are, and we can counsel them on, if we can meet their needs. Sometimes it's based on insurance and skilled needs, so we can talk to them about that. They can call their doctor, and their doctor can call in a referral. Or the referrals should be coming from the hospital or the nursing homes, but clients really need to advocate for themselves, and if they feel that they're being sent home and they have a new diagnosis, or they have an exacerbation of an old diagnosis, or they've got this wound care that the hospital may think they're okay with, but they're just unsure, to make sure that they're asking for a referral, letting the hospital know what their situation is at home, because they don't always know.
Sure. And it can be from the patient, or a family member can do this for them?
Yes.
Okay. Good. Thank you very much. So I appreciate all that you shared with us today about helping people come home from the hospital. People of all ages, too, we're talking about, because home care serves young people all the way through the end of life. So we have a lot of needs to consider, and it's great to have people with such wonderful backgrounds who understand the whole process and have good relations in our community. We appreciate all that you both do for helping people stay safe and healthy at home. And thank you for being here with us today.
Jen.
Sure. And I just want to remind folks that they can call our agency, as we've mentioned, anytime, whether you're in the hospital or talking with your doctor, or you have some concerns right now and want some more information about how we can help you or loved ones stay safe at home. Please call us at 527-7531, or visit us online. We have a lot of things going on right now that actually I'd like to point out. We have flu shots coming up. It's already fall, so our flu shot clinics will happen in October, and you can find a full schedule on our website, which is www.fchha.org, and you can help protect yourself and loved ones from catching the flu this season. We also want to point out this beautiful quilt behind us that was made by members of Franklin County Home Health, and that's being raffled. We do an annual quilt raffle, and you can find that at the Farmers Market in September, and Key Bank and Union Bank will be showing it off as well. So we encourage you to check that out. And that's going to be raffled off at our Blue Jean Ball, which is in October 26th, and tickets are on sale for the public for that event as well. So please, if you have any questions about the information we provided today, call our agency at 527-7531. We thank you for watching, and be well.